When you look at global health success stories, there are a few that really stand out. But Thailand's well, it's truly in a class of its own. For a middle-income country to achieve universal health coverage, something many much wealthier nations are still grappling with, is just a massive achievement. Today, we're going to break down exactly how they pulled it off. This is the story of Thailand's healthcare revolution.
But let's start with a really fundamental question. What if getting sick or having a loved one get sick didn't threaten to bankrupt your family? For millions, even billions of people around the world, that's a very real, everyday fear. Well, in Thailand, they decided to completely change the answer to that question.
And to really get just how incredible their journey was, we have to rewind the clock. Let's go back to the time before 2002, because the healthcare landscape for the average Thai person looked completely different. This number right here, it tells such a powerful story. Back in 1995, almost half of every single dollar spent on healthcare in Thailand came directly from the pockets of ordinary families, right at the moment they needed care. This created this huge, unpredictable burden. I mean, can you imagine having to choose between medicine that could save a life and paying for your child's education? That was the reality for so many. And if we break that down a little more, you can see just how things were stacked. Private spending, mostly those out-of-pocket payments we just talked about, made up the majority of all healthcare financing. The government's contribution was the smaller piece of the pie. What this meant in the real world was pretty simple. The quality of care you got often came down to how much money you had. And then everything changed. A deliberate, politically driven decision was made to totally reshape the country's health system. And this wasn't just some small tweak or minor adjustment. No, this was a revolutionary leap forward. But this didn't just happen overnight. As this timeline shows, it was built on a really smart foundation of careful planning. It started way back in 1992 with the creation of the Health Systems Research Institute to gather the data. Then, in '99, the Decentralization Act started shifting power. All these steps paved the way for the big one, the 2002 National Health Security Act, which officially kicked off universal health coverage. So, what did universal health coverage, or UHC, actually mean for Thailand? It was a simple but incredibly profound promise, and it was written into law. Every single citizen would get access to essential, high-quality healthcare. And your ability to pay, that would no longer be a barrier. Period. So here's the really clever part, how they paid for it. They made this huge strategic shift. The old way was just giving hospitals a chunk of money and hoping for the best. That's called supply-side financing. Instead, they switched to demand-side financing. The money followed the patient. Think of it this way. Instead of the government just giving a restaurant a lump sum of cash, it gives all the customers a voucher to eat wherever they want. All of a sudden, the restaurants have to compete to give the best food and service to attract those vouchers, right? That's what this did for healthcare. It made hospitals more efficient and way more responsive to what patients actually needed. So how did they actually structure this whole thing to make sure every single person was covered? Well, they didn't just create one single massive government program. They built a really clever, interlocking system of 3 separate schemes. And this table lays it out beautifully. First, you have the Civil Servant Scheme, or CSMBS, for all the government employees and their families. Then there's the Social Health Insurance, or SHI. This one's for people working in the formal private sector, and it's funded by contributions from the employee, their employer, and the government. And then you have the final crucial piece of the puzzle, the Universal Coverage Scheme, the UCS. This was the giant safety net that swept up literally everyone else. Farmers, street vendors, the elderly, children, and it's funded by general taxes. Together, these 3 schemes left no one behind. And this chart, wow, it really shows you the massive scale of that last piece. The Universal Coverage Scheme, the UCS, covers nearly 3/4 of the entire population of Thailand. It is the absolute backbone of the whole system, making sure the vast majority of citizens are protected. Okay, so that's the theory, that's the structure. But the big question is, did it actually work? Let's take a look at the results. Let's look at the scorecard after 2 decades of universal health coverage. So let's just quickly remember where we started. Back in 1995, people were paying for almost half of all healthcare costs right out of their own pockets. That's a huge, unpredictable, and really risky burden. Now, look at the after picture from 2019. This is just staggering. Those out-of-pocket payments have plummeted from nearly 45% all the way down to just 8.5%. I mean, if you want a single number that proves the system protects families from financial ruin because of sickness, this is it.
But it's not just about the money. The system is also incredibly fair. In fact, this might be one of its most amazing achievements. It's what we call a pro-poor system. That means the poorest 20% of the population actually use health services more and get a larger share of government funding than the wealthiest 20%. In so many health systems, it's the other way around. Thailand completely flipped that script and built a system that truly helps those who need it most.
And the impact on people's actual health? It's been just as dramatic. The maternal mortality ratio, which is a key measure of how strong a health system is, fell by a whopping 40%. That's not just a statistic. That represents thousands and thousands of mothers' lives that were saved.
And you see this progress reflected right across the board. Life expectancy for both men and women has seen this steady, significant climb. It's a clear testament to what happens when an entire population gets better access to prevention, to treatment, and to care.
But, the story doesn't just end there. Success creates its own new challenges. As Thailand got really good at solving problems like access and infectious diseases, a whole new set of complex issues started to appear on the horizon. And this chart illustrates the biggest shift of all. The kind of health problems people face has completely changed. In 1999, chronic, non-communicable diseases, things like heart disease, cancer, diabetes, made up less than 60% of the country's health burden. By 2019, that had jumped to 73%. And these are the long-term, expensive conditions that require decades of care, putting a whole new kind of strain on the system. And it's not just those chronic diseases. The system is now facing the pressure of a rapidly aging population that's going to need much more long-term care. It's dealing with the complexities of childhood malnutrition and the huge global threat of drug-resistant bugs. These are the new frontiers for Thailand's health system.
So what's the big takeaway here? Thailand gave the whole world a powerful lesson. Universal health coverage isn't just a dream for rich countries. It's an achievable goal for everyone. The great question now is whether this incredible system, which was built to solve the problems of the past, can innovate and adapt fast enough to face the challenges of the future and thrive for the next generation.